Hello, one of our subscribers asked us to talk about the fallopian tubes. We are going to talk about the fallopian tubes. Lero tugenda kwogera ku nseke ez'abakyala. So without further ado, we shall begin by defining what the fallopian tubes are. The fallopian tubes specifically are those parts of the female reproductive system which are specific for the transport of the egg. The fallopian tubes in Luganda, they are known as enseke. Enseke zino ze zitambuza eggi ery'omukyala oba ze zitambuza amazzi oba enkwaso ez'omusajja. So leero tugenda kwogera ku fallopian tubes oba enseke ez'abakyala era nga tetumaze budde bungi tugenda kugamba nti enseke zino ziri divided into different parts. When we take a look at the fallopian tubes, it is divided into different parts. The first part is known as the corneal part of the fallopian tube. The next is known as the infundibulum. Part of the fallopian tube, and then there's that part also known as the ampulla, and lastly there's that part known as the fimbria, which is kind of like, it appears as if they are fingers of a person. So that part is specific and it is actually the part which receives an egg which is released on the 14th day. So oba otunulidde enseke ez'omukyala ojja kulaba nti zirina parts nyingi. Waliwo part gye bayita the corneal part, waliwo gye bayita infundibulum ebeera nga tube awagazi, and then waliwo part eringa ekoona gye bayita ampulla, and then waliwo eno eringa engalo eringa appearinga ng'engalo gye bayita fimbria. So part eno gye bayita fimbria ye receivinga eggi ku lunaku olw'e14 webanga ogenze mu kye bayita ovulation. So without further ado, we are proceeding with our lesson for today. We are answering a question asked by one of our subscribers. This is Gerald Massa, the health educator, and it's the name of the channel. If it's your first time on this channel, remember to subscribe so that you watch videos about fertility and reproductive health. Obanga gwe mulundu gwo ogusoose ku channel yaffe, subscribinga oberenga olaba videos ze tukola buli kaseera nga twogera ku nsonga ez'ekikyala, endwadde ez'abakyala, n'engeri ki gy'osobola okubanga ofuna olubuto amangu. We are talking about the fallopian tubes. Kati eggi ery'omukyala we liba nga libadde released ku lunaku olw'e14 ojja kulaba nti ligenda mu luseke. Ate we liba lituuse mu luseke, oluseke lulimu obuntu ng'obuviiri obusweepinga oba obutambuza lino eggi eribadde fertilized ne liba nga lisobola okugenda ne lyekwata ku kisenge ky'omukyala oba kye bayita endometrium. We liba lyekutteko liba ligenda kukula paka nga lifuuse omwana. The fallopian tubes specifically transport a fertilized egg which has been released on the 14th day during ovulation, and this egg is transported and it is swept along by means of hair-like structures known as cilia. So if a woman has issues with the fallopian tubes, then movement of a fertilized egg or movement of the male sperm is going to be difficult. Omukyala wabanga alina obuzibu mu nseke ojja kulaba nti eggi lijja kuba terisobola kutambula bulungi. In other words, lisobola n'okubanga libeera blocked ne liba nga lisigala mu luseke. Eggi eribadde fertilized ku lunaku olw'e14 we lisigalamu ne liba nga libadde blocked, ojja kulaba nti ate omwana oyo akulira mu nseke oba mu luzungu tuba tukiyita ectopic pregnancy. Eggi erikulidde mu luseke ebiseera ebisinga liba zibu nnyo oba lisobola okuteeka mu state eya emergency. Ectopic pregnancies are a result of a fertilized egg remaining or getting blocked in the fallopian tubes, and then it grows into a pregnancy known as an ectopic pregnancy. So this is always an emergency. Tugenda maaso ne musomo gwaffe ogwaleero tuli kwogera ku fallopian tubes oba enseke. Mbuuza ebibuuzo byonna byonna by'oba olina wansi awo, nja kuba mbiddamu obulungi ate nja kuba nkubuulira. N'oba nga oyagala okuba nga oyogeramuko nange mu private, osobola okuba nga ogenda ku email yange www.geraldmassa@thehealtheducator.com oba ku WhatsApp yange +256 701 7978 0876 tujja kuba tweyongera okuba nga tuwayamuko. We are talking about the fallopian tubes. Now, the fallopian tubes tend to be affected by many conditions. The first condition that normally affects the fallopian tubes is what we call inflammation. Inflammation mu Luganda kiba kitegeeza nti ensekezo zisobola okuba nga zirumbibwa ebirwadde ebyenjawulo. Inflammation kiba kitegeeza omubiri gwo guli correspondinga ku injury eba etuuse mu luseke. So omukyala agezezaako okuba nga afuna olubuto ate n'abanga alemeddwa okuba nga afuna olubuto, ojja kulaba nti ebiseera ebisinga yandibanga either alinamu amazzi amakyafu oba nedda osobola okuba nga olinamu ebinyamanyama, mu luzungu tubiyita adhesions, ate n'ekirala osobola okuba nga olinamu kye bayita scar tissue. So ensekezo eziba zaziba ebiseera ebisinga ojja kulaba nti okufuna olubuto kiba kizibu, n'oba nga olufunye chances ez'okusigala mu luseke ziba nnyingi nga woolaba wano mu kifaananyi. So we are saying that the fallopian tubes can be affected by three main conditions. The first condition is what we call the first condition is what we call scar tissue, and then the next is HYDROSALPINGITIS, where there is fluid collection in the fallopian tubes, and then of course also the fallopian tubes can be affected by various infectious diseases. So we are proceeding with our topic for today. We are talking about the fallopian tubes. Let me know if you have any questions. I will answer all your questions down below in the comments, and then also you can book to have a private consultation with me on my website www.geraldmassa.healtheducator.com. So we are proceeding with today's lesson, and we are saying that the fallopian tubes are very key. The point we need to take from this lesson is that many times, even if you have one fallopian tube, you can go on and get pregnant. N'obanga obadde olina oluseke olumu, kyenjagala okutegeezako mukwano gwange kiri nti osobola okugenda mu maaso n'obanga ofuna olubuto. So okubanga ensekezo zaziba oba omanya otya nti ensekezo zaziba oba zirina obuzibu. The signs of a blocked fallopian tube, or the signs of disease of the reproductive system, or fallopian tube specifically, sorry. So wosituukira okumanya nti olina obuzibu mu nsekezo, ojja kuba owulira obulumi, naye ng'obulumi buno bubeera ku side emu. Busobola okuba ku side eya left oba side eya right. Ate obulumi buno buba bwa maanyi nnyo obanga gwe bafumise akambe, ate obulumi buno tebukendeera. So ojja kulaba nti obulumi buno buba bungi nnyo, more specifically n'oba obadde n'ebbaawo mu kwegaata, ojja kulaba nti wabeerawo obulumi bungi nnyo, naye ate butera kuba ku side emu, tebutera kuba ku side zonna. Sometimes omukyala abanga abadde alina obuzibu mu nseke zonna, then asobola okufuna obulumi buno mu sides zombi, naye nga ebiseera ebisinga the biggest percentage, the pain which is due to fallopian tube disease is normally unilateral, meaning it is always either on the left side or on the right side. So obanga oli mukyala oli eyo ogezaako okufuna olubuto biganye, bakukebedde enseke zaziba, naye nga wandiyagadde okuba nga ofuna ku advice singako awo, osobola okuconnectinga ku WhatsApp yange ne tuba nga twogera okuwayamuko, n'ekirala osobola okuba nga nkulagirira eddwaliro lyaffe we riri, n'oba nga osobola okujja ne twogera ebisingako awo. Gerald Massa, the Health Educator, is the name of the channel. We create awareness about fertility, reproductive health and ultrasound. N'oba nga okoze scan oba ka TV naye ng'oyagala okuba nga ofuna second opinion, omusawo abeere nga akuvvuunulira ebisingako awo, otegere bulungi ripooti yo yalaze eki, beera nga obimpeereza ku WhatsApp, nja kuba mbivvuunula, results zonna nja kuba nzikuvvuunulira, era mbeere nga nkutegeeza solutions eri embeera yonna gy'oba ozudde. Sanyusa nnyo mukwano gwange okuwuliriza. I welcome you on our channel. On this channel, remember to subscribe so that you do not miss new videos we release every day. Subscribe so that you continue watching our videos. Nyiga epesa erya red erya subscribe obeere ng'osobola okuba nga ofuna videos zaffe ze tuteekayo buli kanaku, twogera ku nsonga ez'ekikyala, osobola otya okufuna olubuto amangu naturally nga tokosezza treatments ez'ebbeeyi ennyo, ate n'ekirala osobola otya okumanya omubiri gwo n'oba obadde opulaninga kubanga ofuna olubuto. Eno ye channel yo, beera ng'okomawo enkya, nja kuba nteekayo video endala. Gerald Massa, the Health Educator. Why are you not seeing your periods after a miscarriage? You have had a miscarriage and you are not seeing your periods. why are you not able to see your periods after a miscarriage? I welcome you, my friend, for today's lesson. One of our viewers asked a question and she said, why is she not seeing her periods after her miscarriage? It's coming to 2 months. She is not able to see her periods. We are answering this question. Watch up to the end because there are lots of tips for you to answer this question. So without further ado, we shall first of all talk about what a miscarriage is. When we are talking about a miscarriage, specifically, this is a pregnancy loss, at least before the pregnancy makes 20 weeks. So if you are pregnant and before the pregnancy goes to 20 weeks, there happens to be a pregnancy loss or you lose the pregnancy, actually we call this a miscarriage. So why are you not seeing your periods even after you've had the miscarriage? Even after losing the pregnancy, why are you not able to see your periods? First of all, I welcome you on our channel. Gerald Massa, the Health Educator, is the name of the channel. On this channel, we do talk about fertility, we talk about pregnancy tips, we do give you advice on how you can get pregnant faster, on how you can become fertile and get pregnant faster. And then also, we do give all pregnancy tips, anything related to women health. I welcome you, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. So without further ado, I'll first of all talk about a miscarriage. A miscarriage is a serious condition. When it happens, the first thing is the couple needs to go through a process of healing, both emotionally, psychologically, and then also physically. So if a miscarriage has happened, it's always good to realize that there could have been a problem. There could have been a cause of this miscarriage to happen. You do not need to put the guilt on either of the partner. You should not take up the guilt, because when you become guilty and then you begin putting it on yourself, if you did not induce it yourself, then it may actually put you in depression, and it may affect you psychologically, emotionally, and all areas. So allow yourself time to heal, allow yourself to go through all the healing process. Follow the advice of the experts, and remember, you can get pregnant again even if you've had a miscarriage today or you've had a miscarriage at any time. You can still get pregnant. The only thing you need to do is you need to get the advice of the experts and then follow that advice. Put in prayers. You can get pregnant faster. You need to put God first. So without further ado, we are going to answer the question that was asked by one of our viewers, and she said she had a miscarriage, but she has waited to see her periods. Her periods are not happening. Her periods are not seen. So we are saying that the first way we are going to answer this question is, first of all, to identify that if at all you've had a miscarriage, let's say you've had a miscarriage today, and then after 1 or 2 months or after 2 to 3 weeks, you are still spotting, you are still bleeding. This could mean that you could be having an issue with what we call RPOC. RPOC simply means you could be having retained products of conception. You could be having an issue with retained products of conception. Retained products of conception, we mean the pregnancy could have come out, but when there's still remaining pregnancy tissue in your womb. How can you tell that you have retained products of conception? Because you might have had a miscarriage 3 weeks back, but you are still bleeding. The only way to identify that you could be having retained products of conception, you are still having the blood coming out. The only way to identify is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan, we've talked about it before. It is a test whereby images will be taken of your reproductive system. These are the ovaries, fallopian tubes, and then your womb. The pelvic ultrasound scan will show how your womb is. If there are retained products of conception, your inside, the endometrial stripe, will not actually be visible. Your doctor will not be able to see this inner lining known as the endometrial stripe. What will be seen on a pelvic ultrasound scan to confirm that you are having retained products of conception will be lots of contents. We call them echogenic contents. You'll see that on your report. If you do your ultrasound scan and the report comes out and it shows that you have lots of contents inside with a volume of maybe 10 mils, 50 mils or 100 mils. I've worked on clients who have volumes of 200 mils, lots of echogenic contents. They think that probably the pregnancy actually came out fully, but when they are still having lots of contents, lots of pregnancy tissue and mixed with blood. So when you have had a miscarriage today and then after 2 to 3 weeks or after 1 month you've had a miscarriage and you are still bleeding, please urgently go and do a pelvic ultrasound scan. Do it from a reputable place whereby you'll get real results. And once these contents have been identified that you are having these, then your doctor will suggest possible alternative, or your doctor will suggest possible medical treatments for you. Your doctor may decide to give you drugs to help expel these contents if at all the volume is low. Or your doctor could actually opt for your doctor will actually advise for removal through a special procedure known as a D&C. D&C simply means dilatation and curettage. It's a procedure which is done in theater whereby these contents will be removed manually, and normally it's a painful procedure, but you need to prepare yourself psychologically for this. And yes, your doctor will take you through all the counseling pre-operatively, that is before you go to theater. Your doctors and the nurses, the attending nurses, they will help educate you on what will be done in the theater, and then of course you are supposed to sign the consent form allowing that this procedure gets done. And after this procedure has been done by your doctors, remember this is a procedure which is advisable. You should not refuse to do the procedure, because what happens is that if you are having these contents in your womb and then they are not removed, you are most likely going to go into what we call sepsis. Sepsis is when these contents, remember, they are mixed with blood. They may actually begin rotting. And then when they do rot, what the end results are going to be, this infection is going to filter into your bloodstream because your uterus is supplied with blood vessels. So these rotting substances or these clots can easily go into your bloodstream, and then they may actually travel to your heart, and what may result may not be good. You may go into actually shock. You may go into what we call septic shock, whereby you actually, the results will not be good. So remember to have these contents removed either through tablets. If at all the volume is very low, there are drugs which can be given. This video is for education purposes only. We shall not mention all those different types of drugs. But there are special drugs which can be given. They can force your womb to expel these contents manually. Normally, you will experience pain. Remember, the pain is as a result of the contractions happening, and specifically, it may actually be similar to the contractions you get when you are giving birth. But remember to be strong, have this removed, and then give yourself a waiting time of at least 3 months. After these 3 months, you can still get pregnant again. But I always advise my clients to use these 3 months as a time of healing, as a time of identifying what was the cause of the miscarriage in the first place. So we've talked about the miscarriage, we've talked about what could be the causes of bleeding after the miscarriage. We are going to answer the question that was asked by one of our viewers, and she said that she has not been able to see her periods after 2 months of having the miscarriage. she had the miscarriage and then 2 months passed, but she is not able to see her periods again. So we are answering this question. Remember, you are on Gerald Massa, the healtheducator.com, the best fertility pregnancy channel. So ask me all your questions in the comments. I really love to answer all your questions. Ask me anything about pregnancy, about fertility, about how you can get pregnant faster, and I will answer. I will give you my best advice on how you can get pregnant faster. So we are saying that when you are not able to see your periods after 2 months of having had a miscarriage, then the cause could be that there's an imbalance in your hormones. But before we answer this question, we need to identify, or we need to understand that normally when a miscarriage has happened, there's always a cause. When a miscarriage happens, there's always a cause. To see your periods, to get pregnant again after having a miscarriage today, the most important thing is identify the cause. So to wrap up the whole thing, to answer this question that was asked by our subscribers, she's not able to see her periods. The answer is identify the cause of the miscarriage in the first place. We say that miscarriages have causes. If the cause of the miscarriage was stress, remember when a woman is pregnant and she's undergoing excessive stress, she's experiencing excessive stress, there are high chances that there's going to be a hormone. It is called cortisol. It is a stress hormone. So when cortisol has been released, there are high chances that it's going to bring about a miscarriage. So if the cause of the miscarriage was stress, address the stress, manage the stress, and then your periods will simply come back, because when you are out of stress, there are high chances that your hormones are going to go back to normal, they are going to balance. If the cause of the miscarriage was infections, probably maybe you had a PID, also known as a pelvic, a PID also known as a pelvic inflammatory disease. If you had a PID, which is actually confirmed, which is confirmed by doing a pelvic ultrasound scan, free fluid will be seen in a part which is known as the pouch of Douglas. Remember, we've said that the pouch of Douglas is the part between your rectum and your uterus. So if there's free fluid collecting in that part, and you were pregnant and you had the PID, then it's very simple. Treat the PID and then your periods will come back to normal, because PID brings about an imbalance in your hormones. And remember, to see your periods normally, your periods have to be normal. Your hormones have to be normal. You have to be going through the 3 phases, that is the follicular phase, when the eggs are growing, the ovulatory phase, when you are ovulating, and then also the luteal phase, when you have just finished ovulation and probably you've got pregnant, then the periods do not happen. They will not appear. If at all you do not get pregnant, then these hormones are going to drop and then you'll see your periods. Ask me all your questions and I will answer them. So to answer the question asked by our subscriber, she has not been able to see her periods. The answer is find out the cause of the miscarriage. Go to hospital, let your doctor do all the routine tests. Your doctor will do the pelvic ultrasound scan. Your doctor will do a urine analysis test. Your doctor will do a high vaginal swab test. Your doctor will do actually also some other tests like a urine culture and sensitivity, whereby part of your urine will be taken to the lab and then culture and sensitivity will be done and then the cause will be identified. Remember, you can get pregnant. Ask me all your questions and I will answer them. We have lots of work we are doing in the community with our community-based organization, where we are looking at where we are reaching pregnant mothers in hard-to-reach areas. They are pregnant, but they cannot access ultrasound scan services. So we are using our expertise. We are looking at reaching most of the pregnant mothers in our country, Uganda, in our community. The causes of irregular periods. How to get pregnant with irregular periods. In this video today, we are going to talk about the causes of irregular periods and how you can get pregnant even if you have irregular periods. Are you a woman? Are you a couple and you have tried to get pregnant but you have irregular periods? Then in this video, we are going to discuss the causes of irregular periods and everything you need to know about the causes of irregular periods. Gerald Massa, the Health Educator, is the name of the channel. After this short break, we are coming back and we are talking about the causes of irregular periods. After this short break. Hello my friend, welcome for today's lesson. This is Gerald Massa, the Health Educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerald Massa, the Health Educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you. Thank you, my friend. We are talking about the causes of irregular periods, and without further ado, we are going to go to the first cause of irregular periods, and this is known as anovulation. Anovulation simply means failure to ovulate. If a woman does not release a mature egg on the 14th day, we call this anovulation. So if you are not able to ovulate, then it means you will not be able to get pregnant, because during ovulation the mature egg, also known as the Graafian follicle, is released, and this mature egg goes on and it gets fertilized to become a fertilized egg or to become a fertilized embryo. So anovulation is among the leading causes of irregular periods. The main reason is that for ovulation to take place, the two hormones, the follicle stimulating hormone and the luteinizing hormone, should be within the normal ranges. If these two hormones are not balancing, then there are high chances that fertilization or ovulation will not be able to proceed. So the first cause of anovulation, the first cause of irregular periods is anovulation, and we have said that anovulation simply means failure to ovulate. So if you are a woman and you are asking yourself, why are you not getting pregnant? Why do you keep having irregular periods? This month you see your periods, next month you do not see your periods, then anovulation could be among the things which could be happening to you. Remember, the only way to confirm that you could be having anovulation is having tests done on you. Specifically, your blood should be checked for. You should have a test done which is known as the fertility hormonal screen test. And we are proceeding with our lesson for today, the causes of irregular periods, and the next cause is known as polycystic ovarian syndrome. Polycystic ovarian syndrome, abbreviated as PCOS or polycystic ovarian disease, PCOD, is very, very common nowadays. It's becoming very common. This is when your ovaries specifically grow some small swellings. These are known as cysts, and because they are many, they are called polycystic ovarian syndrome. So if you are a woman and you are having irregular periods, then you could be having polycystic ovarian syndrome. If you have not heard about this condition, it is among the leading causes of irregular periods, and the only way to confirm that you could be having polycystic ovarian syndrome is that you should check with your doctor, who will request for some tests to be performed on you. Your doctor will do what we call a pelvic ultrasound scan, and by doing the pelvic ultrasound scan, images of your ovaries, images of your reproductive organs will be taken. More precisely, your ovarian reserves or your ovarian follicular activity, or the follicles are specifically those
those round-like structures where an egg grows until the 14th day, that is the day of ovulation, when that round structure bursts or ruptures, and then an egg is released to go on and get fertilized. So in polycystic ovarian syndrome, when you do an ultrasound scan, the report will show that your ovary is lined with many small fluid-filled growths or fluid-filled masses. These are what we call the polycystic ovarian syndrome, or these are basically what we call the polycysts. So remember, even if you have been told that you have polycystic ovarian syndrome, you should not lose heart. You should not despair. One thing that is true is that even if you have polycystic ovarian syndrome, you can get pregnant. You can easily get pregnant. The key is that you should have yourself get checked. Your doctors will do a pelvic ultrasound scan on you, and then also your doctors will also request for a laboratory test to be done on you, where a profile of your hormones will be analyzed. A profile of your hormones will be analyzed, whereby